The World Health Organization estimates about 2.5 billion people are at risk of dengue globally. Now, 70% are right here in the Asia-Pacific region.
Well, a meeting of experts in Jakarta this weekend will be looking at the rise in dengue in the Asia-Pacific. And ahead of that meeting, we are speaking to Dr. Duane Gubler, who is in Jakarta. And Dr. Gubler is the director of the Asia-Pacific Institute of Tropical Medicines and Infectious Diseases at the Duke-NUS Medical School. Dr. Gubler, thank you very much for joining us. First up, why is Asia deeply concerned about dengue? This is not something new or foreign to this region.
Well, it's definitely not new. It's a very old disease, and it's been occurring in Asia for hundreds of years. But they should be concerned now because we're seeing, number one, increased transmission, actually epidemics in a number of countries in Asia, many of the countries, but also in Latin America. It's important to understand that epidemic dengue occurs in periodic cycles every 3 to 5 years in endemic countries. And the factors causing the epidemics are not fully understood. There's a whole myriad of factors, both intrinsic and extrinsic, that determines whether there will be an epidemic. The major problem is that we don't have good mosquito control methods. We don't have a vaccine yet that can effectively prevent dengue. So it's important for countries to do everything they can to prevent these epidemics and to put in place good clinical diagnosis and management programs.
Yeah, so just on that point, Dr. Gubler, what exactly should Asian governments be doing? I mean, we know that in this region, it's a very varied approach, isn't it?
It is. Probably the most important thing Asian countries and other countries in endemic areas can do is to educate, to train their medical community and their nursing community on clinical diagnosis and management of dengue hemorrhagic fever, the severe form of dengue. Many, especially young physicians and nurses, don't understand the pathophysiology of this disease. If it's diagnosed early and managed properly, case fatality rate shouldn't be any more than 0.5%. So that would be the first thing that the governments can do. The other things that they should do is to rebuild their vector control capacity, the capacity to control the mosquitoes that transmit this disease. They need to realize that vaccines are in progress or in being developed in the pipeline, and that these should be available in the next 2 or 3 years. So they should have a plan how to introduce these vaccines and to integrate them with the vector control. And the last, not the last thing, but also important, is to increase their advocacy, to educate the public on what causes the disease and what they can do to help the government prevent the epidemics.
So, Dr. Gubler, very, very quickly, what are some of the key topics or measures that you will be discussing at this weekend's meeting in Jakarta, though?
Well, we'll be discussing exactly those factors. We realize that to effectively control this disease, we're going to need to implement integrated programs, programs that actually integrate more effective vector control with vaccination programs and with community outreach to involve the community. So basically this meeting will be to bring public health officials from various countries up to date on what's available and what's coming down in the pipeline.
Thank you so much for speaking to us, Dr. Gubler. Duane Gubler, the director of the Asia-Pacific Institute of Tropical Medicines and Infectious Diseases at the Duke-NUS Medical School, where there will be a meeting of experts in Jakarta this weekend looking into the rise of dengue in the Asia-Pacific.